Hi, Ms. Hickey. My name is Jasmine Khatib. I am a second semester dental hygiene student here at Algonquin College, so it's nice to meet you. Today we have you booked for a cleaning, polishing, and a checkup here, so I think it's about a 3-hour appointment in total. So just a little brief description about what we're going to be doing. I have these packaged instruments here, and we're going to be doing a quick cleaning, so taking off the plaque from your teeth. We'll move on to a polishing to remove some of that stain that's potentially going on, and then once we are done, we'll have the dentist come in and do a quick checkup. Do you have any questions or concerns for me to answer?
No.
So I would just like to let you know as well, we do have clinicians come in to, So I would like to let you know that all assessment findings, treatment plans, and activities will be reviewed by our clinicians here in the clinic, and the dentist as well. Speaking of, here we have my supervising clinician, Miss Natasha Sabadash.
Hi.
She's an experienced registered dental hygienist at the college clinic, and she's just going to be popping in periodically to see how everything's going and to make sure everything is okay. And once our session's done, she's just going to check all over my work and do my grading for me.
Okay, sounds good.
All right.
All right.
Let me know if you need anything.
Thank you.
One. All right, so Ms. Hickey, this is Dr. Hannah Fraser.
Hi.
She's the dentist who will be
Nice to meet you.
overseeing your care today, on top of myself, of course. So she's going to help us review the health history, and then once we're finished the cleaning and the polish, she's going to come in and do the final checkup for all the hard tissues in your mouth.
Okay, sounds good. Okay, great. See you
I
later.
keep making
See
these
you.
stupid faces. All right, Ms. Hickey, how are you feeling today?
I'm very nervous.
Oh, is there anything I could do to maybe help you during this experience?
Well, I had a really bad past experience. It was very, very painful for me the last time I had my teeth cleaned.
All right, well, as a student hygienist, I'm actually able to get permission from my clinician to use a topical anesthetic. So, for example, we have something that is called Oraqix, or Oraquix, and it does look like a syringe. I will warn you in advance. However, there is no injection going on. There's just a small needle tip that gets kind of put between the tooth and the gum, and we put a little drop of the Oraqix in there, and it does help with numbing. So what we could do is do half a mouth at a time and see how you feel, and we could just take it slow, and if needed, you can come back for a second appointment.
Oh, thank you. I think I'd really like to do that.
Okay, awesome. That's great. And did you have any main concerns about your oral health for today's visit other than the pain?
Well, I have a lot of stain. Like, my teeth are really yellow, and I'm very self-conscious about it. So if you can make my teeth whiter, I'd really like that.
Yeah, well, it does depend on the stain, so we could definitely take a look at that during the appointment, and we can do a selective polish and take off what we can. If needed, we can also do a bleaching consult for you if you'd like.
Yeah, that'd be wonderful. Thank you.
Awesome. Okay. All right, so now that we've talked about a little bit of what's going to go on, and I've given you just a few options in terms of the staining and stuff like that, I'd just like to get your go ahead and approval that we can start the rest of the appointment. I would just like to get a signed consent for you here for today's treatment.
For sure.
Awesome, thank you. All right, so now we are just going to go into the health and dental history, if that's okay with you.
Yeah.
So just a brief description of the health history and why we do it. It just helps us gather important information about your overall health to help us create a care plan that's specific to your needs and your goals. It also helps us gain a knowledge of medical conditions that you may have to help us better help you and to prevent any medical emergencies from happening in the clinic. Do you have any further questions for me before we proceed through the form?
No, not at all.
Okay, great. So, on the medical history, I had a quick chance to look over it, and I saw that you checked off low blood pressure. Do you have any prescribed medications for this?
Yeah, I actually brought it with me today.
Okay, awesome. So I'll document that in your chart a little bit later once we're done. I just have a few more questions as well. So have you had a chance to see a doctor and get properly diagnosed
Yes.
with the medications? Okay, great.
Yeah.
Have you ever lost consciousness while sitting or being lied back supine, like laying on your back in a dental chair?
No.
Okay, awesome. So So just from that alone, we are good to go for now. Do you have any further questions for me before we start treatment? So now that we're done with the medical history portion, we're just going to move on to the dental specific. So how are you feeling about your general oral health today?
Pretty good. My only issue really is just the staining. I mean, I have a bit of pain, so maybe I know that there might be an issue there. But those are really my only two concerns, is the pain that I experience when I brush and the staining.
Okay, and is the pain just there when you're brushing, or have you noticed it at other times, like flossing or just biting?
Yeah, definitely flossing. Sometimes when I eat food, it's kind of painful as well.
Okay, and can you describe the pain for me at all? Like
Stinging.
It's stinging. Okay, so that's definitely something that we're going to mention to the dentist when they come in for a checkup. And has there been anything else? It's just the staining and the pain?
Yeah, just that.
Okay, and I know you were mentioning that a few challenges would be like brushing and stuff like that. Has there been any other things that might have been impeded by this pain, like eating, drinking?
I'm not quite sure because it's been pretty constant, so I know brushing triggers it, the pain, but it's usually just always there. And
Okay, so and it's been for about how long now, would you say?
It's been for about 5 months.
Okay, so quite some time. And you've been able to get by without like taking any medications, or have you been taking like Advil?
Sometimes I'll take Advil.
Okay, okay. Well, I'll definitely mention that to the doctor, and we'll be definitely very careful when we're cleaning your teeth and doing the polishing. As I said, the Oraclicks can help with the numbing, so we can do half the mouth at a time, and if you feel it's too much, we will take it easy and we'll book a second appointment after the checkup. And the
Okay,
polish.
sounds wonderful. Thank you.
Awesome. Okay, sounds great.
Toothbrush, sweetie. Oh my god.
Is there anything that I could do to help make you feel a bit more comfortable during our procedure today?
Can I have apple juice, please?
Are you ready to proceed with treatment?
Okay. Here we go again.